afternoon, and thank you everyone for joining the NeedyMeds special topic webinar, Creating Generation Zero, Resources for Prostate Cancer Patients and Survivors. As I mentioned before, my name is Carla, and I am the Education Coordinator at NeedyMeds. Before we get started with today's presentation, I'm going to go over just a few housekeeping tips. You can feel free to type any questions you may have into the questions section of your GoToWebinar control panel, but keep in mind we will reserve answering questions until the end of the webinar. If we don't have time to answer all of the questions, please know we will follow up with you personally via email within about a day after the webinar. Also, the webinar is being recorded, and it will be available for viewing on the NeedyMeds YouTube page as soon as we convert it from the webinar into a video, which usually just takes about a couple of days, so it should be up on the YouTube channel by the end of the week or the beginning of next week at the latest. So let's get started. For those of you that don't know about NeedyMeds, we are a national nonprofit, and here's just a shot of our homepage. I always put that up because our website is really the face of our organization. Anyway, NeedyMeds, again, is a national organization. Actually, we're celebrating our 20th anniversary this year. And we are dedicated to educating and empowering those seeking affordable health care. And we define education in two ways. The first way is by certainly educating people about NeedyMeds and the resources we offer. And two, by letting them know about other invaluable resources and diagnoses information, which is why we are so pleased to have our guest here with us today. It is my pleasure to introduce our host, Sienna Breen. I'm sorry, I always say that, Sienna Breen. My apologies. Sienna is the Patient Support Programs Coordinator at Zero, the End of Prostate Cancer. Sienna joined the Zero team in 2015. And as the Patient Support Programs Coordinator, Sienna helps develop and update patient educational materials, coordinates patient education programming, such as webinars like you're participating in today, and Twitter chats. And she serves as a liaison between Zero and the prostate cancer community. Sienna holds an undergraduate degree in both international relations and sociology from American University in DC. So with a resume like that, how could we not be anything but thankful to have her expertise being shared with us today? So without further ado, I'm going to pass the mic and the screen to our host, Sienna, so bear with us while we do that. And Sienna, you should be able to grab the screen in just a moment. And then you can feel free to take it away. Thanks, everybody, for your patience.
Thank you very much, Carla. Let me go ahead and get this pulled up. Oops. Okay. I hope everyone can see my screen. Okay,
yeah,
great.
That's perfect, Sienna. Thanks.
All right. Hello, everyone. Thank you all for joining us, and thank you very much to NeedyMeds for hosting us. I'm Cienna Breen, and I am the Patient Support Programs Coordinator at Zero, the End of Prostate Cancer. I'm going to take this time today to give you a general overview of our organization, what we do from fundraising to advocacy to patient support, and how all of those things are helping us create Generation Zero. So you may be asking yourselves, who are Zero and what are they all about? Well, Zero, the End of Prostate Cancer is a leading prostate cancer nonprofit organization. Our mission is our name. We are called Zero because we want zero prostate cancer. We are at this time entirely US-based, but we are national in scope. We are working toward our mission by advancing research, improving the lives of men and their families, and inspiring action to end the disease. And our ultimate goal is to create Generation Zero, which is the first generation free from prostate cancer. Now, just a little bit about our history. We were founded in 1996 as the National Prostate Cancer Coalition, and we've undergone a few name changes since then. We were modeled after the National Breast Cancer Coalition. We saw the great strides they were making as the political force for a cure for breast cancer, and we wanted to do the same for prostate cancer. Through the testimony of survivors and those who had lost loved ones to the disease, we brought the face of prostate cancer to Congress, and this led to the creation of the Prostate Cancer Research Program at the Department of Defense, which I will talk a little bit more about later. We celebrated our 20th anniversary last year, and we still continue to build alliances with national and local organizations and within Congress to protect federal funding for prostate cancer research. We also work hard to educate, activate, and support advocates working at the local level as well. So we are very proud of the work we do and the team we have built. For the 4th year in a row, we are listed as one of the Nonprofit Times Best Nonprofits to Work For. We are also a Better Business Bureau accredited charity, and 84 cents of every dollar we raise goes directly to programs and activities. So why do we do what we do? Why is it important to raise awareness of and fight for an end to prostate cancer? Well, prostate cancer is the most commonly diagnosed cancer in American men and is also the 3rd leading cause of cancer death in American men. The American Cancer Society estimates that there will be over 161,000 new prostate cancer cases and nearly 27,000 deaths from prostate cancer in the U.S. in 2017 alone. In the United States, a man is diagnosed with prostate cancer every 3.3 minutes, and a man dies from the disease every 20 minutes. African American men are at both increased risk of being diagnosed with the disease and of dying from it. Prostate cancer is so prevalent that there are currently about 3 million prostate cancer survivors in the U.S. However, the good news is that if caught early, the 5-year survival rate for prostate cancer is nearly 100%. That means if a man is diagnosed with early stage prostate cancer today, he has a nearly 100% chance of being alive in 5 years, which is huge. We really just don't see those numbers with other cancers. And this also really underscores why early detection is so important, especially for prostate cancer. So now I'm going to talk about how we are achieving our mission. Here at Zero, we have 3 main focuses, and those are patient support, fundraising, and advocacy. So first, let's talk about my department, which is patient support. So I want to make sure you all are aware that we have a ton of information and resources available on our website. Our URL is up here in the corner, zerocancer.org. And the majority of our educational resources are housed in the Learn section of the website, which is circled here. And if you click on that tab, you will see this. So here you can see all of the individual sections we have with specific information about the disease. Do you just want general information about the disease? Do you want information about risk and early detection? You can check out the About Prostate Cancer section. Are you newly diagnosed, either with advanced disease or early stage disease? Do you want to know what your next steps are or what questions you should ask your doctor? You can check out the section titled For the Newly Diagnosed. If you are a current patient who wants more information about treatment options or how to maintain a healthy lifestyle both during and after treatment, you can find that information under For Current Patients. We also have some specific pages with information for loved ones and caregivers of men with prostate cancer, as well as for survivors who are not currently in treatment. There's a section of pages I want to highlight, and they are under our resource library over here. We have a webinar series, and we produce between 3 and 6 webinars per year on a variety of subjects, ranging from specific treatment options to managing the costs of cancer care. Every webinar we produce is recorded and archived on this page, so you can find it and view it at a later date. We also have a lot of educational videos, interviews with physicians and patients, and those are scattered throughout our website on various pages, but you can also view them all on that page as well. We have a variety of brochures and fact sheets related to various stages of prostate cancer, specific treatment options, and even covering other topics such as bone health and clinical trials. Every brochure and fact sheet that we produce is available for download on this page. And you can also find information about our Community Awareness Toolkit program on this page, which I'll talk about a bit more in a second. All of the educational content on our website, I should say, is maintained and updated by me. However, I am not a medical professional, so the content is also reviewed by our medical advisory board. And whenever we reprint a brochure or update a fact sheet, after a while, we make sure to get it reviewed by our medical advisory board, so we know the information we're providing to patients is current and accurate. Okay, so the section I have highlighted now, if you're newly diagnosed and want to know what questions you should ask your doctor, you can easily find that information here. And finally, under additional support resources, we have links to other general cancer and prostate cancer specific organizations. We have links to organizations that can assist you with social or emotional support. We have information about financial resources and resources to help you find a doctor or treatment facility if you need it. So next I'm going to take you over to our Get Support tab. And if you click on that, it brings up this. So there's a couple of resources here that I want to highlight. So first, under Managing Cancer Costs, you can find some shortcuts to our Learn section pages on health insurance and financial resources. We've got some good information there, not only about private insurance, but also about Medicare and Medicaid. And we know that veterans, for example, have some unique challenges in healthcare as well. So we've got some information about the VA Choice Program, and TRICARE under there as well. If you would like to get tested for prostate cancer, but the test is not covered under your insurance, we also have a searchable testing map here, where we list all facilities, programs, and events that we know about that offer screenings, and I'll talk a little bit more about that later as well. Again, if you need help talking to your doctor or don't know what questions to ask, you can find that information here. And finally, here is where you can find information on our relatively new patient navigation program called 0360 Comprehensive Patient Support. And this is an important free service that we provide, and I'll talk about that more later as well. So now I'm going to talk a bit more about some of the specific resources and programs I mentioned. First, our webinar and video library. As I mentioned earlier, we have an ongoing webinar series that we moderate and which brings in experts to speak on a variety of topics related to prostate cancer. In the past, we've had between 3 and 6 webinars per year, but that number is usually around 3 or 4. We also often precede our webinars with a Twitter chat to answer frequently asked questions about the topic and to get people familiar and engaged with the topic on social media beforehand. Some past webinar topics include managing advanced prostate cancer, bone health, nutrition, managing cancer costs, survivorship, and genetic cancer, which was our most recent topic. All of our past webinars are recorded and archived on the webpage I pointed out earlier. And our next webinar topic is going to be about chemotherapy and immunotherapy, talking about some misconceptions about each, proper sequencing of those treatments individually, and some new research regarding those treatments as well. We don't have a date set for that yet, but if that's a topic of interest to you, be on the lookout. So next I want to talk about our fact sheets and literature. So each of these links on our website will allow you to view and download that specific brochure or fact sheet. And as you can see, we have a wide variety of materials covering many topics. You can also call us to request hard copies of any of our materials, and we will happily mail them to you. If you're not quite sure what materials you want, you can also just call us and say something like, I've been recently diagnosed with advanced prostate cancer, and I have bone mets, and I need more information. And we'll pull a couple of things that we think will be helpful and either mail or email them to you, whatever your preference. If you happen to be a physician, we are also happy to send you a few copies of any brochure or fact sheet to keep on hand in your office if you'd like to distribute them to patients. And as I mentioned, we do have our medical advisory board review all of our materials to make sure they're current and accurate. And while these materials certainly should not be viewed as an alternative to seeing your doctor about any of these issues, we do hope that they can help you have a thoughtful and more informed discussion with the members of your healthcare team about these issues. Also, if you're going to be attending an event or staffing a table at a community event or health fair and would like to use that as an opportunity to educate your community about prostate cancer, there's a link here to request one of our community awareness toolkits, which I'll talk about next. So we launched our Community Awareness Toolkit program in the second quarter of 2015, and it has become pretty popular since. We've had over 150 requests for toolkits since the program began, 50 of which are from this year alone, so it's definitely increasing in popularity. A Community Awareness Toolkit can help you educate your community about prostate cancer, especially at a health, community, or workplace fair. However, we've had people request toolkits for a wide variety of events that also include holiday parties and garage sales, so really the possibilities are endless here. The toolkit contains educational materials, talking points, and some tips on having a successful table, a tablecloth, and some giveaways like wristbands or pens. And you can find more information about the program under our Join the Fight tab that you might have seen earlier as well. But as you saw, I also put the link with the fact sheets and literature to make it easier for you to find. So next is our free testing map. As I said, if you would like to get tested for prostate cancer, but the test is not covered by your insurance, you can use this map to find a facility near you that offers free testing. Every facility, program, or event that we know about that offers free prostate cancer screenings is on this map, along with any information we know about requirements or if you need an appointment to get tested. And we try to keep this map as current as possible, but the database it's certainly not exhaustive. So we also encourage you to contact us or check out our community testing partners to find other resources if there's nothing listed on the map near you. So finally, I would like to talk about our new patient navigation program, which is called 0360 Comprehensive Patient Support. 0360 is a patient navigation service we launched in October of last year. It is a free service we provide in partnership with the Patient Advocate Foundation. Men and caregivers can either call the toll-free number or use a secure online portal to connect with trained case managers who can help them with a variety of issues, often above and beyond what a typical nurse navigator can provide. So the case managers in this program can help with insurance navigation issues, ranging from helping you understand what's included in your coverage, to helping with the insurance appeals process, to helping solve billing and coding issues. The case managers can also help you find financial aid, either through copay or co-insurance assistance programs, or through cost of living support to address ancillary costs. They can also help connect you with resources for social or emotional support. And they can also help you with benefit and entitlement program, education, and enrollment. And this is really just a snapshot of what we can help with you through, or what we can help you with through this program. So this is an overview of who we've helped so far through this program. 69% of the people who have called 0360 were patients either in need of insurance or financial assistance. The average number of actions taken, so calls made, et cetera, on behalf of each patient who calls is 19, which is a lot. Most of the men who request this service are 55 or older. The largest percentage of them have stage 4 prostate cancer, and most of them have an annual household income of $35,000 or less, so we really feel like this program is helping men who need it. So I'm going to talk about a case study. This is an example of one person we've helped through this program. He's a 56-year-old man recently diagnosed with advanced disease. He has Medicaid and also lost his job after his diagnosis, forcing him to move in with his daughter. He called because he had unpaid medical bills, no income, and no savings, and he needed help applying for Social Security disability and food stamps. Now to show what the case managers in the program can do, the case manager who helped this gentleman coordinated a conference call with a Social Security caseworker to help him enroll in Social Security disability and prepared and educated the patient during this process. When the call attempt was unsuccessful, she then assisted him with his online application and later followed up with him to make sure he was able to successfully complete it, that it was received, and that it would include retroactive coverage to address his unpaid medical bills. She explained to him how to get reimbursed from his hospital and made sure all of his medications were covered by Medicaid. And when he was later hospitalized, she also helped expedite his food stamp application on his behalf. So really, I can't stress enough how helpful this program can be to you or to your loved ones who are facing this disease, or if you are a medical professional, to your patients. We really can help with a wide variety of issues with this program. All right, so let's move on to fundraising. So our biggest fundraiser is our National Run Walk series, the Zero Prostate Cancer Run Walk. We have about 40 run walk events in 25 states across the country, and the majority of our races are held in partnership with local urology practices. The way most of our run walk events work is that 50% of the funds come back to Zero for national programming and support, and 50% of the funds stay local. The beneficiary of those local funds is typically, the beneficiary of those local funds is typically designated by our local urology partner and ranges from researchers to local organizations that provide assistance to patients, to education or screening initiatives, and we are proud to say that we've provided more than $10 million in these local grants since our Run Walk series launched in 2008. In addition to our Run Walk series, we also have what we call Team Zero, which is a group of over 200 endurance athletes who have competed in marathons, triathlons, and other endurance events across the country to raise money for Zero. So if you are active, both our Run Walk series and endurance program are great ways to get involved with our organization and help us achieve our mission. So finally, let's talk about advocacy. If you recall, we were founded as an advocacy organization, and 20 years later, advocacy remains a huge part of what we do and is critical to achieving our mission. At Zero, we fight at the local level and on Capitol Hill to achieve our advocacy goals. We also very frequently collaborate with other general cancer and prostate cancer specific organizations to achieve these goals, so it is definitely a team effort. These are our current policy priorities here. First and foremost, we want to protect and grow federal research funding. For those of you who don't know, congressionally directed research funding for various cancers and many other chronic diseases is housed at the Department of Defense in what is known as the CDMRP, which stands for the Congressionally Directed Medical Research Programs. The important thing is one of those programs is the Prostate Cancer Research Program, or PCRP. For the past 11 years, Congress has designated $80 million for prostate cancer research. So for the past several years, we have been fighting for an increase in that funding because obviously prostate cancer is an extremely prevalent disease, and $80 million doesn't go as far now as it did 11 years ago. Congress finally increased that funding to $90 million for fiscal year 2017, so now we have to turn our attention to protecting that $90 million from cuts in the future. And just to put into perspective how important that federal funding is, in the past 7 years, 3 major treatments for advanced prostate cancer, Zytiga, Xtandi, and Xgeva, have all resulted from research funded by this program. So in terms of federal funding, we also urge Congress to support prostate cancer prevention and education funding through the Centers for Disease Control's Comprehensive Cancer Control Program. Our next priority is supporting robust coverage for cancer screening and treatment, and this is an especially critical topic now as Congress moves to either revise or replace the Affordable Care Act. We also advocate for early detection methods, recommendations, and coverage, and I'll talk a little bit more about that in a second. And we also encourage coordination among federal agencies with regards to these issues, and we're working on raising awareness about prostate cancer issues at all levels of government. We get a lot of assistance from other organizations and individual local advocates on this point. So I want to talk a bit about our annual Advocacy Summit. In 1998, we established the Zero Summit to End Prostate Cancer, and it has since become a yearly event bringing together advocates from across the country to join directly in the fight to protect federal research funding. At our 2017 summit, which took place at the end of February this year, we had attendees from 37 states. The summit consists of an education day first, in which experts come and talk about advancements in research and treatment, and is followed by a Hill Day, in which advocates meet with their congressional representatives on Capitol Hill to talk about the importance of federal research funding. This event helped secure that $10 million increase in federal research funding that I mentioned earlier. And this event is also important because through it, attendees learn how to more effectively advocate in their local communities as well. So here are some additional statistics from this year's summit. We were fortunate to have about 120 attendees, about half of whom were new and half returning. And while a large number of the attendees are prostate cancer patients and survivors themselves, about 50% of the attendees are family members or caretakers of a loved one with prostate cancer. Here you can see where all of our advocates came from at this year's event. This year we really did have advocates from every region of the country. The last thing I want to talk about with regards to advocacy is the United States Preventive Services Task Force, or USPSTF. The USPSTF is a task force that evaluates and makes recommendations with regards to early detection tests. For the past several years, the USPSTF gave the prostate-specific antigen test, or PSA test, a D rating. And as I'm sure many of you know, the PSA test is the most common early detection test for prostate cancer. And while it can't diagnose prostate cancer on its own, it can indicate something is wrong that may require further testing or biopsy. By giving the test a D rating, they were discouraging the use of the test, and their reasoning for this was that it led to overdiagnosis and overtreatment of what might otherwise be a slow-growing or non-threatening disease. This obviously could have repercussions for men with a more aggressive disease or lead them to be diagnosed at a later stage. And it also meant that insurance companies were not required to cover this test as they would be if it had an A or a B rating from the task force. So earlier this year, the USPSTF revised that recommendation and gave the PSA test a C rating. And while this revised recommendation encourages men to start a conversation with their doctors about whether PSA screening is right for them, it still does not require insurance companies to cover the test. And at the federal level, how this correlates with zero is that on the federal level, we support legislation that would create more transparency within the USPSTF recommendation process, and which would require specialists and stakeholders to be a part of this process. So that really brings me to the end of my presentation. Here's some contact information for our main office, our Run Walk program, and our 0360 program, our patient navigation program that I mentioned. And I really thank you all for tuning in and for listening to me talk for the past 20 minutes or so. In just a second, I'm going to turn the screen back over to Carla, and I am happy to take any questions you have with the time I have left.
Fantastic. Thank you so much, Sienna, for that very thorough and really valuable walkthrough of not only the important work your organization does, but how much everybody really can benefit from all of those resources. So I'm going to go ahead and grab the screen. Can you see my screen, Sienna?
Yes, I can.
Fantastic. So as Sienna said, we, of course, will welcome questions. And again, a reminder, you can feel free to type those questions into the GoToWebinar control panel that should be on your desktop. So go ahead and type those in. And Sienna, I do see a couple of questions coming through already. So let me just get started with those. Here's a question probably that's applicable to a lot of people. When should somebody get screened for prostate cancer? You must get asked that a lot.
Yeah, that's a very common question that we get. And like I said, I'm not a medical professional, so I can't tell you, what you should do or what is best for you. But on our website and in our educational materials, we defer to the guidelines set by an organization called the National Comprehensive Cancer Network, and their acronym is NCCN. We do have some information about that on our website and a nice chart that kind of breaks down their guidelines. But basically, those guidelines say that if you are between the ages of, I believe, 45 and 75, you should personally discuss the risks and benefits of prostate cancer screening with your physician and consider getting a baseline PSA and DRE. So the PSA test is the prostate-specific antigen test I talked about earlier, and the DRE is a digital rectal exam where the physician would insert a finger into the rectum and palpate the prostate for any abnormalities. Your doctor, based on the baseline results, would recommend repeat testing either every 1 to 4 years, depending on your baseline level. And if you ever have a PSA over 3, I think the unit on that is 3 nanograms per milliliter, or if you have a suspicious DRE, then your doctor may suggest additional testing. So that's for ages 45 to 75. If you're over 75, you should talk to your doctor about whether or not routine screening should continue at that point. One thing to consider, though, is that race and family history are 2 really important risk factors for prostate cancer. So if you are at increased risk for prostate cancer, either because you're African American or you have a family history of the disease or both, your doctor might make different screening recommendations than he would if you didn't have those risk factors.
That's really helpful and very thorough. And believe it or not, we have another question coming in right on the tails of that one, saying that somebody actually was screened for prostate cancer a few years ago on one of Zero's mobile vehicles. How can they go about doing that again?
Yeah, I get calls about that a lot from people who were screened through that program. So for those of you who don't know, for many years we had a program that was called the Drive Against Prostate Cancer, and we had 2 mobile vehicles that were like buses that went across the country, and we used those to conduct free screenings. And it was a great program, and over however many years, I'm not sure, the program ended before I started here, but we screened, I think, about 130,000 men. However, we did end that program, I believe, in 2014, and we donated those vehicles to 2 local organizations. One of them is the Buddhist Tzu Medical Foundation. They're located in California, I think around LA. And the other was the Partners in Wellness program at the Feist-Weiler Medical Center at Louisiana State University, LSU. So while we no longer conduct screenings ourselves, those organizations, with our support, do use those vehicles for mobile screenings in their areas. And we also have, while I'm on that subject, we have 2 other community testing partners that we directly support, and those are Chesapeake Urology Associates in Baltimore and Los Padres in San Antonio, Texas. And they conduct screenings in their areas as well. Last year, I think our community testing partners overall, so all 4 of them, screened about 1,000 men. So if you live in any of those areas and want to be screened for free, they are who you should contact, and you can find their information. I don't know if you saw earlier, but there's a community testing partners page on our website near where the free testing map is.
Fantastic. And I know that Sienna has referred to in this question section to some things she's mentioned earlier and things that are in the presentation. Just a reminder to everybody listening, we are going to provide you with both copies of the PowerPoint presentations, my little intro one, as well as the more important PowerPoint presentation that Sienna has put together for us today. So I'll be emailing that to all of the participants, and again, you will be able to get you'll be able to view a video of this webinar by the end of this week or the beginning of next week at the latest on the NeedyMeds YouTube channel. I also want to mention, and I'm not sure if it's up on our website yet, but we actually are fortunate enough to have the Zero organization returning to do another webinar. I believe, Sienna, I have it on September 14th. Anyway, check back on the NeedyMeds website to find out when our next prostate cancer-related webinar will be. Now, one other question. Does Zero, and I think you referred to this, but do you guys offer support groups for patients and survivors? That's another question coming in.
Yeah, that's another one that I get a lot. We don't do support groups exactly, but there's one important caveat to that, and that is that we are actually currently building and are hoping to soon pilot a peer-to-peer support program that we're calling the Mentor Program. Through that program, we don't do like physical support groups, but we would match current individual prostate cancer patients in need of support with men who have undergone either the same treatments or who have experienced some of the same challenges, who can chat with them either over the phone or by email about those specific issues. So that's coming very soon, and like Carla said, we're repeating this webinar in September, and so at that time I hope to be able to share more information about how to get involved with that. In the meantime, of course, like I said, if you are looking for social or emotional support of any kind, you can always contact us, look at our website for resources, or call our patient navigation service, 0360, and the case managers on that service can definitely help connect you with the resources you need.
Thank you so much, and again, another very helpful and thorough answer. And as Sienna said, as you can hear from her presentation alone, the Zero organization is really continues to grow and expand, so it's definitely worth staying in touch with them and checking in with us in September so you can sign up for an additional webinar. And I'm just going to take just a quick moment for those of you that, again, that are not familiar with NeedyMeds, and let's say you have been diagnosed, or other family members have, or maybe you need some assistance for healthcare expenses in general. That's when we hope you would turn to NeedyMeds. As I had said in the beginning, we are a national nonprofit organization, and our goal is to help people afford their healthcare costs. And we do that with programs such as prescription assistance programs, which provides expense relief for medications, including generic and name brand. We also have a whole host of diagnosis-based assistance programs, which are really programs that sort of exclude medications, but include cost assistance for things such as durable medical equipment, testing supplies, copay cards. We also have coupons and rebates, and of course the NeedyMeds drug discount card. That's just a snapshot of the resources we offer. Everything we offer is free and anonymous to access. So we do hope you visit our website or give one of our counselors a call on our toll-free helpline to see if we can help you, again, save some money on your healthcare costs. Also, before we wrap up, I just wanted to make sure you were aware that NeedyMeds works pretty hard to make sure we have a robust calendar of healthcare-related webinars. And as you can see, there's just a couple more coming up in this month alone. We have one focused on sickle cell anemia, one focused on breast cancer, and every month, and this month it's being conducted on the 21st, we do a NeedyMeds overview webinar, which will teach people about the resources we have and how to navigate our website. I'm going to go ahead and leave the contact information up for you in case you wanted to jot it down, but also as a reminder that you will get a copy of this this afternoon via email. If you have any questions, don't hesitate to get in touch with myself or Sienna or NeedyMeds or Zero Prostate Cancer at any time. We do hope everybody stays in touch. And thank you so much for taking time out of your day to join us. Sienna, thank you so much for this very valuable webinar. And everybody have a happy and healthy rest of the week. Take care. Thanks, Sienna.
Thank you very much for having us.